Hi, it's Cheryl, Senior Living Family Advocate, and today I wanted to talk to you about something that I've been hearing more and more from my clients, and that is loneliness. I thought that I would dig into that a little bit because a lot of people have parents that are home alone and they're not thriving. And what I found was pretty shocking. In 2023, the Surgeon General said that we actually have an epidemic of isolation and loneliness in this country, especially for people 50 and older. People are not keeping friendships and connections as they age. And the Surgeon General also said that that condition of loneliness and isolation is worse than obesity, physical activity, and like smoking 15 cigarettes a day. That's how bad it is for our health. And what they found is even a small amount of activity and socialization, spending time with others, can reduce your cognitive decline by 70%. So I thought that was pretty amazing. I thought I'd tell you a little bit about a lady, Jeannie. The reason I tell this story is because I help loved ones with assisted living, memory care, in-home care, different things like that. But a lot of people are resistant to assisted living. But Jeannie actually moved to the community when she was independent. But she knew that she was getting older and she was going to need care. So she didn't want to move to an independent community. So she moved into assisted living and she took advantage of, all the activities, that type of thing. But what really happened is she became useful and felt so connected because she would do things like set the dining room table at times. She was the greeter. If we moved someone into the community, she would show them around and kind of show them where everything was and make them feel welcome and invite them to groups. She met people playing games in the puzzle room. She thrived in this environment because she was home alone and she didn't have those kind of connections. And I realized that, and she had family. So a lot of us, your parents do have you coming to visit, kids are there, but it's not always the same as being with your peers, people that share similar history and maybe, certain things to talk about that maybe your kids don't always have any interest in talking about or don't know anything about. So it can be really helpful to have these type of connections. And I think that people probably need to look a little closer at their parents or their loved one to find out how they really are doing at home. Are they isolated? Are they feeling lonely? Have those conversations. A community might be a good fit. And if you have any questions, comments, if you need any resources, give me a call, text, or email. I'm here to help.